I have to get back over here.
Did you lock it?
You can go. Yay! It's working. Always a bonus. Oh, Jean says she just got back from the beach. I'm so jealous, although it's the Jersey beach, so it's probably very cold.
Yeah, that doesn't sound like a beach. That's not a beach trip to me.
No. As I'm sitting here in 3 sweaters. New Jersey. Soon we'll be saying goodbye.
No.
It'll be a lovely thing.
No, I know. Sorry to hear it.
Good morning, everyone. Welcome back. This is our 6th presentation in the Natural Pet Summit, and we are so happy to have all of you here. Thank you for joining us yet again on it's a bright and sunny Sunday morning. It's just cold. So this morning, my guest is Dr. Pj Broadfoot. She's an amazing woman. She started her own veterinary practice in Van Buren, Arkansas in 1982, which has progressed into a holistically oriented veterinary practice. Dr. Broadfoot is a member of the CIVT faculty, which offers Chinese herbal medicine, Western herbal medicine, veterinary complementary medicine, veterinary naturopathy, holistic nutrition, evidence-based complementary medicine, and environmental medicine. Dr. Broadfoot also co-authored the books, The Efficacy of Velvet Antler in Veterinary Practice and Integrating Complementary Medicine into Veterinary Practice. PJ, thank you so much for joining us this morning. We had a little technical glitch, but we're here.
And of course, now my computer turns on now that we're already on the phone.
Oh, well, you know.
Well, anyway, thank you for inviting me.
So, PJ and I have known each other for years, but we had a particularly good time out in Nashville when we went out for Ty Bollinger's Truth About Pet Cancer, and I thought that was a really fun. It was the only time in my life I've gotten on a plane in the morning, flown into somewhere, gotten on a plane in the afternoon, and flown back. It was the fastest trip ever.
I personally thought you were crazy.
Well, you know, at the time, I didn't have much help in my veterinary practices. So it was kind of one of those, oh, geez, I'm taking a day off. I got to close the practice for a day. You know, it's the way it works in this world. But it was awesome. And we had a great time. And
yeah, I kind of understand that scheduling thing until I decided to give myself life. When I had my fourth child, I left the hospital and went to work. So I understand when you don't have help.
we have all done that through the years. I was talking to somebody the other day about, actually it was Ian Billinghurst last night. We were talking about the fact that there's a veterinary shortage. And part of the reason is that us baby boomers have been putting in 60 to 80 hours a week. And the new graduates, I don't know if they're smarter or they just figured out, hey, there's something outside of work.
Mm-hmm. Sure. So nobody wants to own. They don't want to own the practices anymore.
No. So they want to work 30 to 35 hours a week and actually have a real life. So it takes 2 of them to replace one of us.
Mm-hmm.
So we've got a shortage. So we want to talk about deer antler velvet this morning, because I think that you are the leading expert on this particular topic. And that's one of the ways you and I kind of got connected together, was because of the New Zealand deer antler velvet products. So I know we've got new people on this summit that have not been following me for a long period of time. So let's just first start with, I'm going to let you explain, what is deer antler velvet?
Well, the stags have an absolutely amazing amount of growth of their antlers. The antlers that they use in the products from New Zealand are from a deer called Cervus elephas, and elephant would be about right. I mean, they're huge. They're just gigantic, and they grow at the rate of an inch or two a day.
Wow.
And they harvest those antlers humanely. They harvest those antlers when they're mature, and then they utilize those antlers as a supplement. And that most of that antler goes to the Asian market. So, but the other countries have become more aware. It's been used in Asian medicine for over 2,000 years, probably. I think the first written information about it was in maybe the yellow papers, Han Dynasty, thousands of years ago. And in Chinese medicine, it's called Lurong. Amazing. It's an amazing regenerative. You can imagine it, it's something that grows at the rate of 1 or 2 inches a day, would have a lot of factors in it that engender growth and reproduction.
So the antlers have to be harvested while they're still live, because normally the stag at the end of the year the horns basically kind of die off, and then they shed them.
Yes.
And at that point, once the horns or the antlers have died off, then
they're calcified.
They're calcified, and there is no real benefit.
They're good shoe toys at that stage.
At that stage. Well, a lot of people use them for that too. You did say that they are humanely harvested. And I had read a study from New Zealand, and this is one of the reasons why we use the New Zealand products. One, they don't have the chronic wasting disease there that we have here. But two, New Zealand is very, very compassionate to the animals, and they are very strict in their humane treatment of the animals. And I actually read a study that showed they tested the cortisol levels of the deer before, during, and after harvesting, and they didn't change, which means that they weren't stressed.
Right.
So
yeah, they are very. You're right. They have very, very strict standards. They also have very, very strict standards for their supplement. Their supplement industry is really tightly regulated,
which is good. So there is a huge difference between North American antler velvet, which could be elk, deer. It can come from different species, versus the way that it's processed in New Zealand. So that's one of the things that we look for when we're looking at supplements. So give us, without getting too horribly sciencey, give us some of the science behind what the deer antler velvet does. I mean, what are we using it for in our pets, and how does it do the things that we're using it for?
Well, that is without getting too sciencey, there's too many things to talk about. That's why I wrote a small book on it. But
yes, which
it has, as far as like mood leveling, they've known for they've known for thousands. Your library looks like mine.
Yeah, it's there somewhere.
There are thousands of years where they have known that it improved the sense of well-being. Well, part of that is on the science side of it, that there is a natural MAO inhibitor, and there's a natural serotonin in it, which is mood elevating. So there's also a complex of glycans, which is one of the reasons it's used for things like arthritis and in other conditions, inflammatory conditions. There's a huge range of minerals. Obviously it calcifies with time. It's been used in cancer. It's been used in, there's some collagen studies that are really kind of fascinating about that. It has growth factors, tons of growth factors. So and it has some hormone leveling. So those are kind of hitting the high points. there's some specifics that you can talk about, but we use it for, animals with hair growth issues, combined with other things, but for hair growth issues, we use it as kind of a general wellness product, just a supportive type thing. We've actually had dogs with Penta, which is our version of yours, that have alopecia X, have grown hair, which, what dogs grow hair with alopecia X? We've had a number of them that grew hair. So, that's a tribute to the type of biomodulating or immune modulating that it can do. It's really one of those substances that is an epigenetic switch.
So you mentioned cancer, and I've had people ask me in the past. I have stated, maybe wrongly, and you can tell me if I'm right or wrong, that it actually kind of works at the stem cell level and helps with regeneration of different tissues, cartilage, joint fluid, that sort of thing. So then I get the question, well, if I've got a dog with cancer and he's got cells that are replicating that we don't want to replicate, would this product then stimulate that cancer production, or is it somehow modulating the immune system to help it fight against it?
Well, and that's a controversial question, because one of the things that it does have is like VEGF, which is something it's a growth factor for blood vessels, which is a problem in cancer. Mm-hmm. So that's one of the reasons that controversy exists. But that when they've actually done studies in animals with undergoing chemo. And and then also the collagen issue. Collagen, there was a researcher named Pruden that gave collagen to patients that had failed other therapies. And the collagen actually improved the outcomes, put a lot of those into remission. And, my thought has been for a long time that collagen probably improves the cell-to-cell communication, because it is a major component of the matrix, or the mesenchyme. So if you can restore communication, because when cancer is ultimately a couple of things, one is a mitochondrial disaster. So it's an oxygen deprivation type thing. And it's, if you look at the trophoblastic theory of cancer, it's like a placenta looking for a blood supply. But the collagen can change, it's because it's part of that matrix. It can help. I think it, and actually I just read something not too long ago that I think supports that it improves the cell-to-cell communication. So you can actually get the cells to say, what's this sitting out here? Because if the body doesn't recognize it, it can't take care of it. Mm. So that research is in that little book, the Pruden research. So yeah, there's a controversy, but I don't think that has not really stood up to scrutiny as far as making a case that it makes cancer worse.
Okay. Yeah. Have you used it in your cancer patients?
I do.
Yeah, I do too. Okay. All right. Okay. So I think probably one of the biggest things that we talk about with the dairy antler velvet is the arthritis and joint regeneration, because it's a natural source of glucosamine, chondroitin, collagen. It helps with regeneration of those degraded joints. Have you, because you read all the papers on this, have you seen it help, or seen papers where they have looked at using, I know like for the Asian markets, they are using it for fertility problems and that sort of thing. Have you seen studies on cognitive decline or, senior, I can't remember anything, problems?
I don't think I've seen any studies on it. But that's an interesting rabbit hole. Maybe I should go down that. I have actually amassed a rather large file on mental decline, cognitive issues, and I haven't actually studied that particular thing to see if anybody has done anything with it. But it would stand to reason, though, if you if you down regulate inflammation, which is the root of all of that, and you improve cell to cell communication, that you should get some response to that. There's some, now other things that are in there, like the algae, there's clearly some improvement with. Now that I don't know about that particular algae, the algae that I really wanted to be in that product initially was the blue green from Klamath, and they don't grow anything like that there. But there's clearly some data on that one. But things like omega-3 fatty acids that downregulate inflammation, the MAOs, the serotonins, those things that are anxiety is a closely tied to inflammatory responses, closely tied. So if you can downregulate some of the inflammatory stuff, re-regulate the gut, which is where a lot of inflammation starts, then theoretically, or on a gut feel level, that you should actually get some improvement. And considering the sheer swing of patients of people with cognitive disorders, we need to be looking for something because the drugs just don't work.
Right. No, I would agree. So, we are talking about deer antler velvet, but we also wanted to talk about other oral regeneratives. And I think you have kind of listed about 5 in that quick little statement. But what other things should we be looking at as oral regeneratives? Green lip mussel. Is that?
Absolutely. Green lip mussel changed the way I practice medicine about 35 years ago or so.
You were ahead of the curve.
Yeah, well, it was kind of funny because a friend of mine that graduated ahead of me, his first big case was my horse. And actually the third time I applied to vet school, they kept making me take more chemistry classes, didn't transfer for whatever reason. He wrote a letter and said, let her in. She'll be good. So, but anyway, he moved to Indiana, and I've kept in contact with him all of these years. And whenever I'd have a weird horse thing, I would contact him. Well, I had one of my horses, my barrel horse, had tying up syndrome. And so I called him and he said, well, get some DMG. And he said, they got this stuff that's pretty good for arthritis. It's called Glycoflex. And I went, yeah, and I'm ordering from Vermont. I might as well get some. And oh my goodness, you put dogs on and they were off and running. It was amazing. So, startling enough that there's no doubt that wasn't what worked. So, and that's back in the days before Google. You had to actually look things up. So, but I sponged everything they sent me, our journal articles and research, and there's evidence of regeneration with the green lip mussel. And for years, I went to China and lectured about a decade ago. And I was actually looking for research on regeneration with it. And even though there's evidence of regeneration with radiographs and stuff, that I didn't find any data, any research. Well, several years ago, I was down the rabbit hole again, and they actually used the components of the perna, and so therefore the deer antler as well, to build scaffolding to grow stem cells.
Wow.
So it has the components that grow stem cells. And interestingly enough, now we're down the big microbiome trail. It actually improves the microbiome. There's actually data on that.
The green lip mussel.
Yes. Yeah. We've used it regularly for bladder problems in cats for 25 years. So.
Now that's very interesting because I've been using glucosamine chondroitin products for cats with lower urinary tract disease, cystitis, for many, many years, but not using my deer antler velvet green lip mussel products for that. So interesting.
Well, and you also have the advantage of the colostrum, which reduces leaky gut, and as far as like the urinary stuff, like urinary stones, the oxalates. I don't know if you looked at that. I don't know if you looked at that data, but one of the things that is being considered is that we have shifted the microbiome, probably things like Roundup. There's a lot of other things, but Roundup is notorious. It's the most used antibiotic in the world. One of its first patents was as an antibiotic.
And interestingly, people don't think of it as an antibiotic. They just think of it as a weed killer, which that just opens because we've spent a lot of time this weekend talking about the microbiome, and that's kind of how we started with Maria Ringo yesterday morning. And I never considered, because if we just routinely started testing urine and blood samples for glyphosate, which is the product in Roundup, I mean, you read the studies, we're finding it in water supplies, we're finding it in urine. So it makes perfect sense that we're having so much more trouble with the gut microbiome and allergies and IBD and inflammatory diseases and cancers.
In and of itself, it creates leaky gut, outside of shifting the microbiome. But one of the shifts in the microbiome is, a couple of them. One, we'll just focus on this one, but it can shift from oxalate degraders to oxalate producers. So, you've been in practice long enough. Do you remember when all of your bladder stones were almost all struvite?
Yes. And now
there's a lot of oxalates. And so one of the thoughts is that we have shifted the microbiome to where they are producing oxalates, and then the body ends up with them, and they end up in the urinary tract, and we end up with oxalate stones, which are a little harder to get rid of than the struvites. You can't just acidify the urine or alkalize the urine and get rid of them.
Yeah.
So that's a big factor. So we need to reduce the leaky gut, which actually colostrum by itself has been shown to improve the integrity of the tight junctions. They've actually done those studies in kidney cells. So, yeah.
So the colostrum is then also going to be helpful for animals that are in those early stages of kidney disease, where, we've got leakage going on there as well.
Yes. Yeah. Well, and that's the thing I really like about the combination of the products. You get such a broad grouping of things, and specifically the N-acetylglucosamine that's in Perna is one of the primary coaters of the mucous membranes. So, and we've used acetylator for eons now, but that's one of the components. And I think, I had a cat that was on antibiotics all the time, and I didn't like antibiotics 25 years ago, but I really hate them now. I mean, we use them if we absolutely have to, but they shouldn't be a line of first resort. But this cat was on antibiotic after antibiotic. It was so frustrating to work. And then a month later, she'd be back in with it again. Well, that's before we knew a lot about sterile cystitis, and they were probably acting more as an anti-inflammatory than anything else. I mean, as the cooling the system down.
Yes.
But I was so frustrated. I told the owner, I said, Luann, we're missing something on this cat. Let's just put her on a supplement. Well, I put her on New Cat, which back in the day had Perna in it. And
Perna is green lip mussel, for those who don't know. Perna is green lip mussel.
Perna canaliculus. So we put her on that, and lo and behold, she cleared up. And I thought, well, that was really interesting. But years later, there was actually a journal article on using injectable glycans for cats with cystitis.
Huh.
And so I thought, well, that it was the Perna that really made the difference, because the vitamins, the rest of it is vitamins and minerals. So we've used it for a long time since then, just for that purpose. The other interesting thing is I don't have data on, when I was writing the lectures on microbiome a couple of years ago, and looking at like leaky gut type stuff. N-acetylglucosamine, if you look at like blogs and chats online about N-acetylglucosamine, you'll see people that say, it really improved my anxiety. I thought, well, that's kind of an interesting thing. Wouldn't have thought of that, but it's the gut-brain highway. So, and a lot of these cats, the cystitis in cats and women is frequently stress and anxiety related. They're sterile cystitis.
Right.
So anything that improves that that's just another nice added benefit that you get. A good side effect.
Good side effects. Well, okay. So we've talked about colostrum. I mean, I think I think that we have spent so many years ignoring the microbiome, whether it's in our nose, our lungs, on our skin, in our bladder, in our gut.
And our brain.
in our brain.
We used to think it was sterile. We're wrong.
And we've destroyed it over the years for our pets and for ourselves by the overuse of antibiotics, by the overuse of chemicals like the glyphosate and, you know,
Chlorine,
all the
fluoride.
yes, all the things that we've become a huge chemical society, which is just not the best way to go. But it's really interesting how many of these natural supplements, I mean, colostrum, first milk from the cow, well, or any animal in that first 24 to 48 hours. So important. And I think that for generations, I'm going to go human for a minute here, but older generations, children were breastfed because there was no such thing as replacement formula. Then we went through a generation or two where it was like, oh my gosh, breastfeed, who would do that? You know, we've got these wonderful formulas that we'll plug into our kids. And I think we ended
EPA, that don't have EPA, DHA, the right amino acid skew. You can't match it. You can't put the immunoglobulins in. You know, it's sad because we've really just kind of done a disservice to a whole generation of people because we think we can duplicate the creative, you know, the creation, and we can't.
Right. So, you know, now I have a new granddaughter who's 3 months old, and now we've gotten back to breastfeeding again. And it's sort of back to, well, why would I use that chemical filled stuff in a powder when, you know, I've got the good stuff?
Exactly.
For
and you can
my
carry
child.
You carry it with you. You don't have to sterilize it. You don't have to get up in the middle of the night and heat it up. No, you got it with you. Yeah.
Yep. It does make it hard.
I was too lazy to do bottles. So
yeah, it does make it hard for the child to get too far from the mom. Poor Gwen is they're attached at the hip, but it's okay.
It's all right. Yep.
It's a good thing.
It's a short time. So
yes, enjoy it while you can. So what other products? I know that in your Pentagenesis product, which is veterinary only, it has Thymus in it. Let's talk a little bit about Thymus, because that is something that I heard you lecture on, and I was amazed at some of the benefits. But then the bigger question is, so if somebody wants a Thymus supplement, where the heck did they find it? So let's talk about what it does first.
Well, it's another one of those that's so broad. It's the linchpin of the immune system. So it's a huge biomodulator. I learned about Thymus as an injectable when I went to Germany about 25 years ago for Heal. And then, of course, I got to the United States and I couldn't find Thymus injectable to save my soul. And instead, it's hard to get again. I finally gave up, and about 7 or 8 years later, I had a rep come in from a different company and said, "Hey, are you interested in Thymus extract?" And I went, "Yeah." So about 2 weeks later, I got a box in the mail from Hawaii, and it had this powdered stuff and a diluent. Was, of course, I didn't know what to do with it. So I knew that they'd used it for cancer, but I didn't have any cancer cases in for a while. So I just sat on the shelf until Stevie came in, and Stevie was a cat that nothing worked on, absolutely nothing worked on him. And they actually brought him back to put him to sleep. He'd already been to another veterinarian or two, and by the time I saw him, he was thin. He couldn't keep anything down, and to the end of his days, if you walked towards him with something in your hand, he'd start retching. So he was not easy. He was a nice cat, but he just didn't, it was hard to medicate. And
being a cat,
being a cat, I did surgery on him, and because I put barium down him, it never moved. So I thought he had an obstruction. I thought he can't have had an obstruction for that long, but I opened him up anyway. I had my fingers on every inch of his intestinal tract. I was so upset because there was nothing in there. He had ileus. He had a functional ileus. And at that stage, I thought, I don't know what else to use. I mean, he'd had conventional drugs, he'd had non-conventional drugs, he'd had Homotox, which usually works great. He actually had a split spleen. So I'm thinking that he had probably had they found him in a dumpster. So when he was a kitten, so, you know, he had injuries. And, you know, looking back, he probably had chronic smoldering pancreatitis, which we fail to recognize in cats. So, but anyway, I was desperate. I said, okay, I've got this thymus extract. Let me just give him some because I've run out of options. And I'm telling you, it was a miracle. So I got to be friends with the researcher that developed the that particular thymus extract. And I got to interview him last year in Hawaii, 7 hours of interview. So
Wow.
that can tell you how much stuff it's been used for. It's been used for, they had 35 remissions of cancer. And this is just with like individual MDs working with him, different adjuvants. Thymus was the common denominator in that. There have been, they had at least 2 cases of early diagnosed type 1 diabetes that went into remission.
Wow.
I don't know anything else that does that. It's a rejuvenator. If you give it to like old animals, oh my gosh, sometimes they are up and running. It's just, it's amazing. It's bought some time for a lot of patients. We use it. Because it's a, well, I call it a homeostatic enabler. So if you're hyperimmune or hypoimmune, it tends to balance the TH1, TH2, so CD4, CD8. So regardless of what it is, it's kind of puts things in the middle. Thymus determines what we recognize as self or non-self. And even though the thymus involutes with age, it still, the skin picks up some of that activity, and it still works. And you can actually rejuvenate the thymus to some degree. There was a TRIM study that I talked about in the in my wellness lectures this year at AHVMA. And the thymus is truly amazing. The cancer cases, of course, are the most startling, but it was actually developed. Dr. Ushijima developed it because of the weak calf syndrome, which you and I are probably somewhat contemporaries as far as veterinary school. I graduated in 81. And I think that was going on when I was in vet school or shortly beforehand, because I remember hearing about it in vet school. The calves that hit the ground, this is up like in Montana and Dakotas, those babies that hit the ground never get up. They'd never get up. So they were pretty much uniformly wiping out their cattle herds, and they couldn't figure out what it was. So they begged Dr. Ushijima to try and help them figure it out. Well, he said, "I'm a human virologist. What do you want me to do?" So anyway, they just kept bugging him. So he said, "Okay, well, bring me a calf that dies of it, and I'll autopsy." And when he did, he found all kinds of pathology. But when he opened up the chest, he found no thymus, virtually no thymus. It was shrunk, it was involuted down to nothing. So he said, "Where do they put the thymus in cattle?" So he had them bring him another calf that died of something else, and sure enough, there's a normal thymus in there. So then they thought, we transplant thymuses, or he happened to run across, which I don't believe in coincidences. I believe in synchronicity. He happened to read an article, here again, back in the 70s, no Google, read some research by a gentleman named Goldstein, who was doing a ton of thymus extract research at that time. So they did a crude extract of the thymus and said, okay, give like 3 doses, like pull a number out of a hat, give 3 doses this much time apart. Well, the producers there in a couple of weeks later, they're grinning ear to ear saying, "Hey, doc, we've got a problem." And he's thinking, what problem? They're smiling. They're having to rope him to give him the 3rd dose. So they went from uniformly dying to not only surviving, but thriving.
Did they ever figure out what caused the thymus to not be normal in those calves?
Because of the way that it went through the herds, you'd have to think it was something like a virus. What I wonder is a retrovirus. What if it got in, because the retrovirus, if you look at Judy Mikovitz's work with the retroviruses in humans, the much maligned Judy Mikovits, some of those retroviruses got in on vaccines. So is it possible that it was a retrovirus? They are remarkably difficult. They're difficult to extricate and identify, and they never did identify what it was. But it did go through, and they evidently developed an immunity to it. a response to that. It was almost always first calf heifers that were losing the babies. So no, to answer your question, no, they didn't ever completely identify that, but it did have characteristics of something like a virus or a
Do you
retrovirus.
think something like a non-functioning thymus could be part of what we see like in fading kitten syndrome or fading
Yes.
puppy syndrome?
Absolutely. I think it can be. So, and the thing is that so many things will involute a thymus if you don't have enough zinc. So, one of the things that I think is just remarkable in design is that zinc is required for the thymus to stay normal. Colostrum, in every species I studied, preferentially put zinc into the first colostrum. So what about these? So you wonder why orphan babies don't do well. They don't get any zinc. They don't have unless you were paying attention and made a formula that was high in zinc, or it's a colostrum based formula, which they've done now, because they found that a lot of orphans didn't do well. Well, that may be why there wasn't enough zinc to support the thymus. And with age, if you have zinc deficiencies, the thymus will involute. Stress will make the thymus involute. So just the stress of illness or travel, or and look at us with the stressful society we live in. No wonder our why do we have so much autoimmune or hypoimmune states? Well, we just beat the thymus to death. So
Well, and I'm sure all the chemicals and pollutants in our environment are not helping it at all either.
No.
So I know the thymus is in your Pentagenesis product. Are there, do you recommend a thymus supplement for most animals or people, or, and are there any out there that are readily available?
Yeah, you can get thymus glandulars. ARG, Allergy Research Group, has a good thymus glandular and I think you have to be a practitioner to get it, but you should be able to get it through your veterinarian. I think it's easier to get Penta, but the practitioners can all get Penta. And for some things, the thymus extract, the addition of thymus is remarkably useful. Not all animals absolutely need it, but for those that do, it's very useful. The other things on it, Dr. Ushijima's work, if you're going to have 7 hours of interview, and it's all in his head. I talked to him not too long ago about a patient that I have that had lepto and went into kidney failure, had some really bad numbers, and he's actually doing very well now. But he said, he had lepto, and then we got to talking about Lyme, and he said, "Oh, well, I had a practitioner, a MD that wanted my formula, wanted the thymus for Lyme cases," and I said, "You never told me that." Every time you talk to him, something else. But it's truly an anti-aging. The thymic involution is one of the hallmarks of aging. And you look at what happens with age, and your immune system kind of loses track of, it loses its balance. So anything that can help with that balance is remarkably useful. So, but yeah, you can get thymus glandulars. What you can't get right now, and you can get the Keo Prime, which is thymus with colostrum. We use a ton of it in my practice. I like it a lot. It's Keocenix Prime. I always shorten everything. So particularly for some cases, that's a really, really nice combination. The injectable is what I'm really wanting back, because, we use that for allergy cases. Oh my goodness. That done with as an autosanguis. Do you do autologous blood?
No, I have not.
All right. That's time to learn. Because it's body specific immunotherapy.
Right.
So if you can mix it with, there's a lot of things you can mix it with, but it kind of, you're putting blood back into a different space.
Right.
And you're asking the immune system to look at it again.
Right.
And the very first time I ever heard about that was Dr. Oh gosh, I don't remember his name. He was one of the cattle vets at Kansas State, one of the older ones, who's probably younger than I am now, come to think of it. But at the time, he seemed really old. He said, if you can't get that cow over it, take a slug of blood out of the jugular and put it back in the hip. And at the time, I thought, that is a really weird thing to say. Well, a lot of those, did you ever have that happen? Like people would say things that seemed like really weird at the time, and then later on it's like, oh my gosh, that's why. Well, for years I wondered where he even thought, why he even said that. And as it turns out, Mayo Clinic in the 30s and 40s was doing autologous blood therapy.
Interesting.
Yeah, and then it's just kind of, I guess, because you can't patent it, you can't sell it for $1 billion.
Exactly.
It kind of fell out of favor. But if you look at the mechanisms of action, you're taking out whatever's circulating, whether it's allergens or viruses or bacteria, cytokines, and you're putting it back into the mesenchymal space, which is where the lymph goes, and it works by what's called immunological bystander. And you're asking the immune system to look at it again.
Very interesting. Senior year of vet school, I took this class on, it was extra, you could take it if you wanted, but it was on client communications. And so they would, your professors would come in and they would pretend to be clients, and they would present you with these really weird things, or they would be mean to you or whatever. And they videotaped it to see how you reacted. So, I go in the exam room, and in walks two of the professors, and they said, well, we have a mare and she's got a metritis, and we want you to put colostrum in her uterus because we read that can help. Now, nobody had ever taught us anything like that. And I just kind of went, okay, I'm deer in the headlights. I no clue. At the time I handled it the same way I handle those kind of weird things now. Really? That's pretty interesting. Could you get me that article? I'd love to read it. I'll do some more research on it. If it makes sense to me, then absolutely I will do it. So I got an A on that one, mostly because I didn't look at them and tell them they had 6 heads and they were crazy. But knowing what I know now, I would look at that and go, well, it makes perfect sense.
Yeah. Yeah, I've actually thought about nebulizing the colostrum and Thymus extract. On patients, mixing it with saline and nebulizing it, because another one of those kind of Dr. Ushijima, when he was working with the MDs, things just kept coming up. Like one of them said, hey, do you think this would work if I nebulize it? And he went, no. So they did it anyway. They had like 10 or 12 patients with end stage emphysema, and they got no less than 100% improvement in lung function. The average was 300% improvement in lung function by nebulizing Thymus. It's an inflammatory condition.
So here we are in the middle of a pandemic with an inflammatory lung condition.
You betcha.
Hello.
Yep.
Perhaps we should be considering doing things like this.
I know. I contacted Ty, and I've been trying to get a hold of Mike Adams to at least consider it, to look at it, because it's an immune modulator. It will downregulate inflammation. It just makes so much sense to me to do that. Now, you can't get the injectable. Well, now I take it back. There actually is an injectable out there, and I've used a little bit of it. I love the idea of it, but I like to mix stuff. Like I put complex homeopathics with mine, and that particular one you can't mix anything with it. But it has a silver base, so as long as you nebulize it by itself, it should be fine. It's called BioPro, I think. So that one you can inject, but you just can't mix it. There's something about the silver, I think, that precipitates.
So this is what I love about you, because you think not only outside the box, like the box doesn't even exist.
No. No, it doesn't. You know, and I think it's because I grew up in a family that was I didn't actually realize that my stepdad was integrative, I guess if you want to call it that. When he was growing up, the MD, his dad was an MD, so you know my step grandfather was he was a general practitioner. Back in that day, everybody didn't specialize, but the doctor that he chose to take care of his family was an MD/homeopath. It was before the Flexner report. So he trusted a homeopathically trained MD to take care of his family. So I think Dad just grew up with a little more. He said, well, you know, honey, nitroglycerin is a homeopathic dilution. So yeah, it's a 6C or a 12C dilution that was brought here by Constantine Herring, a homeopath. Every MD in the country uses nitroglycerin. So, right. And then he used Rauwolfia. My stepdad used Rauwolfia on his patients with hypertension. He said, by far the best antihypertensive he ever used. You had to titrate the dose, which took time to get the dose right. But he had it compounded. When they took it off the market as a drug, he had it compounded for his patients. So when I was in high school, I wrote an article on myasthenia gravis for a anatomy and physiology class. He had a file. He had a huge file on it. He filed stuff. You know, he was kind of, you know, when I look back, he was remarkable. He solved history. Well, he had patients that Mayo Clinic could not diagnose, and they would send them to him. No, not Mayo, but people would refer to him, and he would get them diagnosed because he took histories. Yeah. He listened to what they said. That takes time, and that's unfortunately. Modern medicine doesn't do that. I mean, it's like my sister says, it's like a cattle call. They want you to see somebody every 15 minutes. Well, you can't do good medicine in 15 minutes. You can't. Not on complex cases. We allot an hour. Our allergy cases, our atopy cases, we block an hour for those cases.
Yeah. Yeah. My consultations are an hour. And, you know, a lot of times, even in that hour, I can't get through everything that I want to get through. So it's like, yeah, well, we'll see you next week for another hour.
Yeah, because especially when they send you 60 pages of previous
or hundreds.
Yeah. It's a lot to sift through. So
yeah, Gwen sent me a consultation file a few weeks ago, and it was like 400 pages. And I'm doing it all. Like, I don't even have physical paper because I don't want to be printing this stuff out anymore. So, you know, I've got this computer file that I'm trying to sift through and read 400 pages. And I got about 100 pages in, and I said, my brain hurts so much. Mm-hmm. I just emailed Gwen back and say, I'm saying no to this one because I just cannot fathom this. This poor animal had been to 20 different specialists, and the problem was getting worse and worse and worse and worse. Mm-hmm. And I'm like, I frankly don't even want to look at everything that's been done because I just want to start from a clean slate and say, I'm just going to pretend that nothing's been done and start from zero. But it's just, I feel badly for the animals, but I feel badly for the owners who have literally been searching for so long. And 99% of them boil down to the microbiome in that animal is a train wreck.
Yeah, and the mesenchymal space is so trashed. You know, that's the genius of, you know, if anybody wants to look up Reckewig and his biological chart, kind of how the body partitions disease. It's a game changer as far as the way you look at things. You know, the matrix has been left out. I know you didn't get anything on matrix. We didn't either. Basically, they call it the mesenchyme, and it doesn't look like anything on a slide. So we virtually have ignored it for 100 and some years. Well, it's 50% of your body, and everything that happens within a cell or with any space anywhere has to go through that space. And disease starts there, and it sits in there until we've gummed that space up, and then it becomes a cellular disease. So we can't ignore that space. Now that we're harvesting stem cells, where does it come out of? The mesenchyme. So now we're a little bit more aware of that space than we were, 50, 60, 70 years ago. But it's you just have to pay attention to the rest of the body. And a lot of things they're sitting dormant in the mesenchymal space. not interfering with anything, that's fine. Once it starts interfering with the function of, which is where the fibroblasts are, and it's a hugely bioactive space. And we have to rejuvenate that space before we can improve cellular function. Then we talked earlier about collagen, and collagen is the framework of that space.
Right, right. So we don't have much time left, but real quickly, since you just mentioned it, are you using stem cell therapy in your practice?
Oh, kind of crudely. Blood therapy is actually stem cell.
Stem cell, yeah, yep.
Because what's PRP, platelet-rich plasma? Where's it coming from? The blood. And then the complex homeopathics, the ones from Heal, which we have to get from out of the country now, drives me crazy. Yeah. Reckewig was actually doing stem cell work back in the 30s and 40s. If you look at those, they actually have components of cells, like placenta comp has placenta. There's some of them that have medulla osseous suis. They're stem cells. They're stem cell embryo suis. They're coming from dilutions of those tissues. So right. they're actually dilutions of stem cells. It's really a remarkable source of it's a remarkable discipline of medicine. It's a little harder to do. It's a little harder to do now without Heal, but it can be done.
But it brings us all the way back around to where we started, which was the deer antler velvet, which is a huge source of stem cell regeneration. So I'm just because I'm sitting here and it's my show, you get the plug, because this is what we've been talking about, folks. The wellness formula has the deer antler velvet, the green lip mussel, the algae, and colostrum. So 4 things that we talked about that are hugely regenerative for our animals, whether it's for gut health or joint health, circulation, so many things. And then our senior one is the deer antler velvet, the green lip mussel, and ginseng, which is more for circulation to the brain, so that we're helping a little bit more with that cognitive function. And then we have the oral drops for dental health that has the deer antler velvet in it as well. And the great thing about it is it's healing and regenerative for the gingivitis, stomatitis that we see in so many animals.
And has manuka.
Manuka, which the Manuka honey hydrosol is a better antibacterial for the bad guys in there floating around than most drugs. So PJ, you are a wealth of information. I can see how you could do a 7-hour interview with someone else, and I literally could sit and talk to you for weeks and not pull everything out of your brain. Thank you so very, very much for agreeing to join us early on a Sunday morning, fight with your computer, your phone, everything else.
Now, of course, now it's on, darn thing.
That's okay. It worked out really well, and we are so appreciative that you would spend time with us. And for those of you that have been joining us all weekend, this afternoon at 1 o'clock, we have Michelle Allen talking about hospice care for pets. She is the founder, along with her husband, Jeff Allen, of Monkey's House Senior Hospice and Sanctuary for Dogs. And then this afternoon at 4 p.m., we will have Dr. Jean Dodds testing for and treating thyroid disease. She's a wealth of information. She runs in the same circles as PJ and I. It's a good group. Yep. Holistic veterinarians. Good group. So thank you very much for joining us this morning. PJ, as always, very much appreciated.
Have a good day, everyone. Thank you.
You too. Bye-bye.
Bye-bye.